We've been working very hard to try and make sure that people are aware of the risk of esophageal cancer that's posed by reflux, but we also are trying to make people aware that reflux is not just heartburn. We conducted a public opinion poll earlier in the spring and found that only 14% of Americans know that reflux can cause cancer. And when you think that only 14% of Americans understand this, and yet it is the fastest increase in cancer among American men, there's a disconnect there. There's a definite problem that needs to be addressed, which is why we filed our petition with the Food and Drug Administration asking that they change the labels on over-the-counter reflux medications to say that if you take this medication, you may be at risk for esophageal cancer, and further, that drugs will not eliminate that risk. Part of the findings of our survey was also that 75% of the folks we surveyed could identify heartburn as a symptom of reflux, but fewer than 30% could identify symptoms like a hoarse voice, a persistent cough, a persistent sore throat. President Obama was diagnosed with reflux several years ago after he had a sore throat for 6 weeks. Most of us don't have doctors as persistent as the president's. And if you aren't aware that a sore throat could mean you have reflux, the chances are good you're going to, over time, start living with it. And that's what we see with lots of people. And yet, if we can get to folks and get them to have a test, get someone to examine their esophagus, find out if that precursor condition is there called Barrett's esophagus, we have outpatient treatments now that can cure that condition, prevent you from going on to develop cancer. So for us, it's a no-brainer. If we make people aware, we're going to catch a lot more cases at early stages that are treatable.